So Doctors Without Borders has evacuated its teams from a major medical facility, that's Turkish Hospital in Khartoum, that's in Sudan. This follows a series of violent incidents endangering staff. Doctors Without Borders provided continuous hands-on life-saving treatment in that hospital for nearly 14 months during the ongoing war, despite many, often deliberate obstructions by warring factions. The war between the Sudanese military factions has forced almost 10 million people from their homes, created famine-like conditions in parts of the country, and threatened to destabilize that region. Let's get a sense of, a bit more of a sense of what that situation is looking like. Bring in Claire Nicolet, who's head of Doctors Without Borders emergency response in Sudan, but joins us now live from Paris in France. And Claire, it's lovely to see you. Welcome to the SABC. Thanks very much indeed for making time to speak to us. I tried in some ways to describe the situation in Sudan, specifically at Turkish Hospital, but I suppose it'll be clearer in your own words. What was it like working there?
So the teams have been on the ground since May 2023. Just after the beginning of the war, we tried to find an hospital there to reply to the situation and to respond to the needs that were huge, obviously, in Khartoum. And we managed to keep our activities running for these 14 months almost. But unfortunately, it has been coming repeatedly with lots of problems, with lots of threats of the warring parties, lots of obstruction as well for us to bring in new teams, to bring in supply. So we have been running these activities for this long time, but unfortunately for now we are suspending our activities. Trying to support still the Ministry of Health, who is still on the ground. Hopefully we want to go back, but obviously with the current situation, it has been a bit difficult to continue our activities, which are quite essential for the population there.
Absolutely. And, you know, it's worrying what's taken place because Doctors Without Borders is known to work in volatile situations. But it seems, of course, as you've explained to us, that the situation in Sudan has gone a bit further than what you're able to actually control and withstand.
Yeah, that's exactly what we are facing. We are facing it since the beginning of the war in April 2023, discussing a lot with warring parties though, and trying for them to respect the facilities, the hospitals, healthcare centers, also obviously our movements. It has been proved very challenging, and at this stage, indeed, it went a step too far for us, and we had to say, okay, for now we need to really take a step back and try to see how we can really operate in good condition. We cannot have people being threatened when they are trying to save lives, to treat patients, and that's the reality of what we are facing indeed in Khartoum.
Sure. You've now had to remove your teams there. How many people are we talking roughly here, Claire?
So we had about 50 people that were still working there. There are still Ministry of Health staff that are remaining there, and we continue to support. But hands-on, of course, it means that we had to remove this whole team.
Sure. And how would you describe how this is likely to affect the operations at that hospital?
It might affect very badly, unfortunately, the operation there. It means that already surgical activity, they will have to be displaced in another hospital, another major hospital, also supported by Doctors Without Borders, Bashir Hospital. But obviously, this is one of the activities. We hope that Ministry of Health will manage to continue activities, especially neonatology, because that's the only place where there is neonatology in Khartoum. Also, pediatric and maternity are very huge in Turkish hospital. So we hope that really the activities can continue, but it might affect very badly, unfortunately, the population there in Khartoum.
Yeah. If it's difficult to work in the hospital, I imagine it's also been quite difficult to get supplies into the country and into that institution itself. I mean, how hard was it to have essentially the tools to provide care when you were still working at that hospital?
Yeah, it's, I wouldn't say impossible because we managed to do so, but it was proved very, very difficult. And of course, it continues with all our projects that we are maintaining in Sudan. not only because of insecurity, but lots of impediments that we are having, administrative impediment, difficulty to have travel permit to move from one state to another. So it has been really a lot blocked, basically, the humanitarian aid. That's a reality we are all facing as international agencies and humanitarian actors. So it's really, really difficult indeed to have the means, the resources to work properly. We are managing our best, but unfortunately, yes, it has been really, really proved very difficult.
Yeah, I can imagine. You did say that you're hoping to go back at some stage to continue with your work. But as you and I speak, do you know if the institution itself is still operational?
Yes, it is, but of course we would like to go back, but one of the things is that we need security for our staff, and we even need our staff to be willing to continue activities, which was definitely one of the difficult points at the moment, that they were really feeling too much threatened and so many pressure on them that they were themselves feeling that it was impossible to stay at that stage. So yes, we hope that we can go back and we can continue activity there. But it is definitely something very difficult.
Devastating indeed. And we all know, of course, that as the warring factions continue going at each other, it's the most vulnerable people that continue to suffer. But Claire Nicolet, one has to understand where you're coming from too. Thank you very much indeed for your time. We appreciate your speaking to us here at the SABC. Claire Nicolet is the head of Doctors Without Borders emergency response in Sudan.